So good afternoon. I am Shamia or Mia, the interim viral hepatitis program director with the Department of Health, and I will be the facilitator for this session. So thank you for joining us. Today's agenda will include introductions and announcements, a didactic presentation on navigating insurance for hepatitis C treatment in adults, and a couple of case presentations, adult case presentations, a Q&A session, and then some closing remarks as well. First, just a quick reminder, please make sure that you have registered through Southeast Age Education and Training Center. You can use the link here at the bottom or the QR code to do that registration, but I encourage you to do it now if you haven't already. This helps make sure, and Clover, thank you, she put it in the chat for us, is in the chat, and you can get registered. This will ensure that you have access to a lot of additional resources, but also have availability to take the short survey for evaluation and obtain continuing education credits. First, some in-chat introductions as well as some brief announcements. Please go ahead and enter your name, your role, your organization, or whether or not this is your first session within the chat. We'd love to get to know you. I do see some familiar names, but always excited to see who else is joining. Wonderful. I see a couple people have added and are returning. So not their first session. So really excited to have you. So with that, we will go ahead and get started on the didactic presentation. Today we have a guest with us, actually, a clinical pharmacist with Vanderbilt Specialty Pharmacy, Dr. Anna Muscarella. So I will turn it over to you.
Wonderful. Thank you so much. Can you hear me okay?
Yes, you're great.
Okay, great. And will you just go ahead and go through the slides, or did you want me to share my screen?
Either way, we usually can go through the slides for you if you just want to let us know when to advance.
Yeah, that sounds great. Thank you so much, Mia. I appreciate it. Thank you, everyone, for having me today. Really excited to be here. As she said, my name is Anna Muscarella. I'm a clinical pharmacist here at Vanderbilt. And for those of you that have been on these calls and are familiar with Dr. Cody Chastain, he and I are colleagues. We work together in the infectious disease clinic, and I am the pharmacist that works with him. So we do navigating insurance all day, every day. Hopefully, this session will be helpful for you in trying to navigate some of your own issues that you're running into. Always happy to be a resource and be available for any questions. Please also feel free to put questions in the chat, unmute. Love to see your faces and love to answer questions. And we can go ahead and get started. So Mia, you can go ahead and advance. I don't have any disclosures or conflicts of interest to report. And if you want to go to the next slide, really our main purpose of today's presentation for probably the next 15 or 20 minutes is to be identifying tools for us to navigate the approval process for hepatitis C treatment. And although many of you are probably already familiar with this particular information, I wanted to make sure that we have just a level playing field before we start our presentation on what are really the steps whenever we have a patient that is being worked up for hepatitis C treatment and we want to get them approved. Of course, the first step is always to assess the patient's coverage status. That can really be broken down into two categories, whether or not the patient is insured in some capacity, that being private insurance, Medicare, or Medicaid, or they are uninsured or underinsured. In the process that the patient is insured, typically, many of you, like I said, are probably already familiar that we go through the prior authorization process. A prior authorization is a step that insurance puts into place for us to actually have to prove why they should cover a particular medication. That often happens with expensive medications because they don't want to just pay for things right away. There are typically criteria and guidance in place as to when or why insurance plans will cover certain medications. PAs can either be approved or denied, and then we can go several different routes after that occurs, ultimately making sure that patients are able to get financial assistance if they need it for these medications. And if prior authorizations are denied, we can always go through some additional steps if we need to. For patients that are uninsured or underinsured, the process is maybe a little bit more complicated. And most of the time in those cases, we really look to patient assistance programs through the manufacturer, and we lean on those to see if we can get patients approved that way, or we look at any sort of institutional coverage or assistance. At Vanderbilt, we do have internal programs to help pay for medication access as well as for office visits and labs, recognizing that's not always the case at other places, but if you are in a location that offers something like that, that may also be a potential option. You can go to the next slide. The first bucket that we'll talk about is for insured patients. With rare exceptions, all hepatitis C treatment and all medications will require some form of authorization, usually in the form of a prior authorization or a PA. This can be completed in several different ways. One that you all are probably commonly familiar with is the electronic portion, and this is typically done through a website often called Cover My Meds, where you can initiate PAs through an online portal, and those are then sent directly to insurance companies and payers. You can typically attach supporting documentation to this, and it's a very easy electronic process. And most of the time, you'll receive some sort of approval or denial via fax or via electronic portal if you have access to that. We also do utilize paper PAs, and in these particular cases, if payers are not on Cover My Meds or do not have access to some sort of online portal, you may need to call and get their preferred form. If you do have a patient that has a Blue Cross plan, for example, they have kind of generic PA forms that will come up in Cover My Meds, and oftentimes you'll have to call and get a specific form for hepatitis C or hepatitis B or whatever else it is that you're trying to get approved. You can call insurance. They can usually send you that form via fax, and then you can fax over the supporting documentation. You can do PAs over the phone. That is a third option that's on here. I will say that is a less common form, and that's not something that we utilize very often. Most of the time, if we're trying to get some sort of extension with a PA, that's the route that we will go. But otherwise, it is 90% of the time electronic or paper form, and I would say more so electronic. TennCare or some of our Tennessee Medicaid plans, usually you have to do a paper form in those cases. Go to the next slide. And something that I am so excited that we even get to say at this point in treating hepatitis C in the state of Tennessee is that every state does vary as far as their sobriety requirements for whether or not they will approve hepatitis C treatment for patients that have either undergone substance use treatment programs, have had to abstain from substances for so many months. This restriction actually went away and has made approval much easier in some ways. They do have some other restrictions and requirements that you can see are listed on the slide here. We do have to provide a genotype to Medicaid. We have to provide history of patients' treatment status, whether or not they have cirrhosis, and then if we have any particular reason why we would select one agent over the other. I think one of the probably the most common reasons that we also do get consulted is because the Medicaid programs in Tennessee do require that the prescription is written in consultation with an ID or a GI specialist. And then you also have to provide clinical documentation. If you are in any way going to be practicing in a different state or seeing patients in a different state that have Medicaid programs, just know that their sobriety requirements might be different. And it's definitely something that you can look up easily and see what those restrictions might be. But that has really changed even since I've been in this role over the last 4 years. This has really changed, which is great. This is a super exciting thing. Here is an example of a PA form. This is specifically for TennCare. You can see right there, question number 1 is, what is the patient's genotype? And then here are some other questions that are listed below, similar to what we just discussed on the previous slide, some clinical information about patients that will be requested. If you don't have access to obtaining a patient's genotype, or if a patient's viral load is too low and a genotype cannot be run, you can put other in this category, just knowing that TennCare will immediately deny prior authorizations for patients that don't have genotypes. So something that we've done in our clinic is, if we see that that is the case for a patient, or for whatever reason we're not able to obtain a genotype, we do have just a standard appeal letter form that we utilize, and we draft that right away so that we can just get that signed, and we can move that process forward once the denial is received. Go to the next slide. Prior authorization responses usually take about 24 to 72 hours to return, depending on the plan. And once you actually get your PA approval, yay, this is great news. There's a couple different steps you can take after that. We do have an embedded specialty pharmacy here at Vanderbilt, so we are able to run test claims to make sure that, yes, the PA was approved, and we can get the patient's copay. If you don't have access to something like that, depending on which pharmacy that you send the medication to, you can always call and have them run the claim, just to make sure, again, that everything's approved, make sure you're getting a clean copay, and making sure that there's not something going on that maybe you're missing, that the patient has a secondary insurance, for example, that might pick up the remainder of their fill. For most patients that have Medicaid plans, especially in the state of Tennessee, the copays range between $0 to $1.50 per fill. So most of the time for our TennCare patients, we can upfront give them that information, especially for those that are on fixed or low income. Something also that we can talk about as far as planning for those costs, or discussing potential assistance as well. For Medicare patients, we are not able to use manufacturer copay cards. So we do have the option to go the foundation or grant assistance route. And then, of course, for patients that have private insurance, we can certainly utilize manufacturer copay cards. I did just have a note on here that if you have a patient that is HIV co-infected and has IAP, or insurance assistance program through the state, there are only certain pharmacies that can fill for patients that have this. And we'll talk about copay cards a little bit later, but they do have maximums on those copay cards. So that's just also something to be aware of. For PA denials, this is the other option, of course, once you submit a PA, most of the time they will give you reason as to why the PA was denied, which could be you didn't submit for the preferred agent, you need to provide them with additional information, or there was something about their criteria that you didn't meet. Usually the next steps are either to write an appeal letter, or in your denial, it will typically tell you what the next steps are. Sometimes that can include something called a peer-to-peer, which is where yourself or someone from the office can speak with a medical professional that is working for the payer, the insurance company, and you can discuss the case via phone. I really prefer to do that if possible, because it's a lot easier to explain something and answer questions in real time rather than having to go back and forth via fax. You can keep going here. Here is some information about the available hepatitis C copay cards through the manufacturer. You can see that all of our commonly used direct-acting antivirals are listed here on the left-hand side, and the copay cards bring copays down to $5 total. You can access these using the manufacturer website, and there are some specific details about who will qualify. But something that I just really wanted to point out is that if a patient's copay is very high, and what very high means per manufacturer is a little bit different, but let's say if it's $2,000 with their insurance, sometimes these copay programs will require an additional benefits investigation on their behalf and an override before they are able to cover the copay fully. So if you send in a prescription to CVS Specialty Pharmacy, they get a copay card and the patient doesn't hear back from them, sometimes that is the case that there is an additional override that's needed. So if you do find out that information, just know that that can take a couple extra days. But like I said, all of them $5 copays, relatively easy to sign patients up for these. You can do that on the website. Patients don't need to do that on their own. You can go to the next slide. If for any reason your patient does not qualify for a copay card, for example, they have Medicare or they've maxed out the copay card, for example, or the copay card is still too expensive and they need some additional financial assistance, you can utilize available grants. Grants are another option where you do need to submit patient's household size and income. Usually these are income-based grants, and you can see if the patient will qualify. You can go to the next slide. These are all of the available grants that we utilize in our clinic and that are available that I'm aware of for patients with hepatitis C. There may be more that I'm not aware of, but unfortunately, over the last couple of months, the only available grant that we have been able to access is the Patient Access Network Foundation, or PANF. You can see that on the slide here, there are several different eligibility criteria to consider when you're applying patients for grants. Generally, my experience is that if you're able to provide a general sense of what the patient's household size and income is, oftentimes the grant programs will not come back and ask for proof of that information. Sometimes that does happen, but for the most part, these are relatively simple and easy for you in the office to sign a patient up for. But yes, unfortunately, right now, our grants are really closed except for PANF. So that is also something just to be aware of. You can go to the next slide here. So as far as on-treatment considerations, things just to keep in mind that if patients don't start on time or they fall in and out of care, we may need to request a PA extension. If they have insurance changes while they're taking medication, that is something else that we often have to deal with. So we may need to reapply for PA approval if a patient has a new insurance plan. And because of that, we always encourage patients to call for their refills at least 7 to 10 days out. Most specialty pharmacies will already follow that cadence, but that allows for plenty of time if you need to do another prior authorization or something to that effect. And then emergency shipments too. This is just a point to make sure that patients are aware that if they ever go out of town or they run out of their medication, that they know who to contact, where they can get that information, and knowing that that's always an option for them. So. For underinsured patients, we can always try to go the route of the patient assistance program if we're not able to get PA approval, or if for some reason patients don't qualify for grant coverage. Sometimes that need to go through an exception committee, especially if patients are already insured to some degree. But we have had luck with PAP programs in the past where the patient's plan was not covering enough, was too expensive, and we've been able to get coverage in that way. So you can go to the next slide. Speaking of patient assistance programs, there are patient assistance programs through AbbVie and Gilead. AbbVie covers glecaprevir pibrentasvir, which is trade name Mavyret. Their PAP form is pretty straightforward. It's only 2 pages, whereas Gilead's is a little bit longer and does have an extra step involved, but that covers all of our sofosbuvir-based regimens. You can go to the next slide. Whenever you're submitting a PAP form, the requirements here are, of course, you have to submit the enrollment form signed by both the patient and the provider. You do have to provide some proof of income as well as household size, and then any relevant clinical information. If a patient does not have any sort of proof of income, what we've had luck doing in our clinic is we have written letters alongside the patient, have them sign basically stating what is their current financial financial situation and what is their household size, how are their needs being met. And we've had some luck being able to get patients approved that way. And then just some information for you all. If you do run into this, there is a Mavret patient support as well as Gilead patient support that includes their copay program, their patient assistance program. There's also some really great just educational information on there, which is this slide and the next slide for Mavret and Gilead. But would encourage you all, if you haven't taken a look at these before, they do have some great information on here, and you can submit the PAP forms electronically if needed. I prefer to do them just in person, make sure the patient can sign, make sure the provider can sign, just gives me a mental checklist to see that I have all of the available information that I need. But would encourage anyone that hasn't taken a look at this to take a look at that. So I know that I am right at time, but happy to answer any questions that anyone has about what was presented today. And if not today, always happy to answer any questions at any point as you're going about your navigation journey for hepatitis C approval.
Thank you so much. So with that, we will pause and see any questions. Dr. Chastain.
All right, so I want other people to ask questions, but I'm going to add a leading question. I incredibly benefit from being able to work with Dr. Muscarella in my clinic as a collaborative practice pharmacist, and I recognize that that is a unique opportunity and arrangement that we developed over time at a large medical center. And I know we have supported a variety of clinics and programs. Are there specific steps that are separate from just pathway navigation that you would encourage providers on this call to recognize that pharmacists or a pharmacy can do / should do, and specific things that you would encourage people to do to develop a relationship to help offload burden from a clinic that might be under-resourced?
Mm-hmm. Yeah. It's okay. Thanks. That's such a great question. I appreciate that. And I love having this conversation. So I won't take up too much time to try to answer that. But for the providers on this call, if there are local pharmacies or pharmacies that you are often sending these prescriptions to, a lot of times specialty pharmacies will have pharmacists and pharmacy staff that are dedicated to those disease states. A lot of times it's hepatitis C, HIV, Hep B, and there's a group of pharmacists that are dedicated to those patients and to that disease state. So if you're sending in prescriptions to Walmart specialty pharmacy, Kroger, wherever else it might be, Walgreens. If you start to get the same people on the phone and call and ask questions, ask to speak with specific pharmacists, and then just being able to have that established relationship over time, you'll have people that you can call if you need them to run a test claim, or, hey, I have this really weird case that they are not able to get their medicine. We've tried all these things. Do you have other recommendations? I think if, as you are pursuing that relationship, just making that effort will allow you to have people that you can call. And I think over time, I would just encourage anyone to do anything like that, especially at local pharmacies, if there are folks that you can call and ask questions to. Because a lot of times, I will say it's very convenient that we have access to our dispensing software. So before patients are even seen in clinic, I'm able to run a test claim and say, okay, it looks like Epclusa is preferred for this patient. So we can actually tailor our counseling to something like that. So I think that's something else that, just to Dr. Chastain's point, developing those relationships, regardless of the pharmacy type over time, is just really beneficial. So same with PAP programs. I ask if I get a good person, I ask for their name and their extension. So now I call the same person every single time, so that I know that that person will help me and be helpful. So.
Yeah, what an excellent point. We have, I know I have seen that where we're trying to navigate some of those same things, helping those with insurance and being able to get a hold of a particular person and getting used to them. So that's a fantastic point. I didn't think about it for the larger pharmaceutical companies and the PAP piece. So great point. We'll take
Yes.
that.
Yeah.
So yeah, thank you for mentioning it. I will just point out too, I dropped in the chat a list, a pretty comprehensive list of pharmaceutical company patient assistance programs and cost sharing assistance programs that NASDAQ has put together for those of you that are familiar. And then I'm also going to share a link to the TDH Project Echo content page. Everyone should be able to find it in their iEcho, but I just wanted to say that not only will this presentation, it is already there posted for those that would like to circle back to this because it's a lot of really great information. But we also have information from Dr. Allen, who shared some information related to patient assistance programs and PAs and things like that as well. So lots of resources, as well as many other resources too. But any other questions or comments? I see a few pharmacists on the call as well as providers. So any of you have any questions or comments about some of the things that were already shared?
Hey, Mia, I do have a question. I know, you mentioned certain copays, are very high. And I personally encountered that with a patient not too awful long ago, and where the copay card maxed out.
Mm-hmm.
And that was the first instance that I had ran into with that. And so the additional route that I had to take was to basically get an override, like what you were talking about, through the drug manufacturer. And I was just curious if there are other programs, or I know you mentioned some grants a little bit ago, that in the event that comes up again, which I probably won't be the one navigating that, as we have now taken on working with pharmacists, which has been fantastic. But is there another route in the event that comes up again that is a little bit easier to navigate?
Yeah, that's a great question. Thanks, Lindsay. I would say that my recommendation, it's kind of a process of elimination in that case. So, oh, I don't know why the light just went out in the office, but so in that case, what I would probably do is I would probably pivot and see if they would qualify for a grant and see if that would be an option for them. If not, you can always attempt to at least call the patient assistance program, explain the situation, and essentially explain, hey, the patient was approved. This is their clinical information. We've tried to use the copay cards maxed out. Is there any way that they could receive just their last fill or whatever it is, from you all? I think in that particular case too, it's explaining to the patient maybe why that happened. So do they have a high deductible plan? Is their secondary insurance not picking up the copay? Whatever that situation might be, and trying to go the route of seeing, okay, let's try a grant, let's try patient assistance, let's see if we can go from there. That's probably what I would do. And I will say more than likely will have success in one of those routes. Just on that note, I wanted to mention, because there's only one grant available now for hepatitis C, our department has actually contacted the patient assistance programs, and they are planning on reviewing those on a case-by-case basis. And I think that they would do the same, and they have done the same for patients that have maxed out their copay cards. That's a great question, though. Thanks.
Really helpful. Well, thank you so much. I don't see any questions in the chat, but if anything else comes up, please don't hesitate to come off of mute or add them.
Yeah.
But we will pivot to our case presentations now.
Yeah, thank you guys so much. And feel free, even if you get stuck somewhere and you just need another set of eyes, always happy to take a look at anything. So thanks for having me today.
Thank you so much for joining us. We really appreciate it.